Hello, welcome to From the South. I'm Laura Prada from our Telesur studios in Caracas, Venezuela. Now we have for you our headlines at this hour. Venezuelan President Nicolás Maduro informed of 3 new COVID-19 cases and expressed the country's solidarity with the U.S. people. Saudi-led coalition announced its forces would begin a ceasefire this Thursday, a step that could pave the way for peace talks. Russia has said that dropping oil prices below zero is nothing but a speculative act. Now we begin with our news. You stay with us. Venezuelan President Nicolás Maduro reported 3 new COVID-19 cases on Tuesday, amounting to a total of 288.
Hoy tenemos 3 nuevos casos.
Today we have 3 new cases that raise the total to 288 cases. Fortunately, 42 of these cases, 102 patients have already recovered. We have 77 patients hospitalized, 52 more in diagnostic centers, 27 in private clinics, and sadly, we have 10 deaths.
The president also expressed his solidarity with the people of the United States.
United States only on Tuesday recorded 2,583 deaths. Sadly reported over 22,000 new cases in just one day, and a total of 45,097 deaths and 115,000 cases. All of our love is with them, all of our blessings, our support and solidarity is with the United States, which is the epicenter of this terrifying crisis. You have also seen in the news, hooded armed groups with weapons of war in the streets supporting Trump and asking that the quarantine and other preventive measures be lifted. Pictures and images that you can see everywhere. These armed groups taking to the street, blocking avenues. They accuse healthcare personnel and health professionals of being communist, telling them to go to China.
And more than 1,000 people have been detained over the last 24 hours in the Dominican Republic for violating the quarantine. Since last Saturday, the country has imposed a mandatory curfew as authorities are ordered to detain those who do not work in essential services. Since this emergency measure was put in place, over 40,000 people in the Dominican Republic have been detained during curfew. The Mexican government has approved an amnesty law paving the way for the release for the first time non-violent offenders to lower the risk of coronavirus outbreaks in the country prisons. The government says the bill could benefit about 2,600 inmates in the federal prison system. This bill would include those convicted of less serious offenses like non-violent robbery or small-scale drug possession if the culprit was poor, forced into the act, or if they had a disability. Inmates who are indigenous would also be freed if they weren't guarantee a fully fair process. The bill also provides amnesty for those convicted of abortion. The Mexican government has also suspended all non-essential work activities until May 3rd and asked people to stay at home, although it has not enforced a mandatory quarantine. As of Tuesday, Mexico reports over 8,700 COVID-19 cases and 712 deaths.
All non-essential work activities in the public, social, and private sectors are suspended. This allows the most efficient mechanism to move millions of people out of public space without the need to use public force.
And with social distancing measures in Mexico, people are choosing to buy their groceries in neighborhood stores rather than big supermarkets. Aiza Garcia from Mexico has this story for us.
In Mexico, neighborhood stores have become the safer choice for most.
They come more often, they don't take too long, they leave quickly. This is the best for a small business like ours.
Known also as corner stores, during these weeks, they have become essential as most people avoid large supermarkets.
They take care of us quickly here. We don't like the supermarket because over there it's more likely to be infected.
They say it's safer because it's less likely to catch the virus here.
We know these people, so we feel safer in our own neighborhood.
It's estimated that in large cities, neighborhood stores supply close to 50% of a family's basic goods.
We are a basic sector of the economy. We offer necessary goods. Not everyone likes going to the supermarket. They feel safer here and are treated well. We know our customers and we like to treat them well.
They have remained open through thick and thin, be it during a hurricane, earthquake, drought, or even a pandemic. We can clearly see that despite the rise of supermarket chains and the arrival of many new competitors, neighborhood stores remain the most important distribution channel of basic goods for Mexico.
Aiza Garcia, Telesur, Ciudad de México.
Now we move on to Brazil. Intensive care units across 3 Brazilian states are now operating at full capacity due to the coronavirus pandemic. Our correspondent in Sao Paulo, Brian Muir, has the details. Welcome.
Last week, health authorities in Amazonas, which is the Brazilian state with the highest number of per capita coronavirus patients, announced that their ICU units in the public hospital system were overflowing. And from that point on, anyone who needed to get on to a respirator had to wait for someone either to recover from coronavirus or die who was in the ICU ward. Now 2 more Brazilian states have announced that they're in the same situation. Ceará and Pernambuco, which are 2 states in the impoverished Northeast, have both announced that their ICU wards are completely full due to the coronavirus outbreak. Now, Brazil has 26 states, plus the federal district of Brasilia, and each one has their own public health system. They have a lot of autonomy on how to use their resources that come from the federal government every year. But the fact of the matter is, although some states are doing much better, the numbers keep increasing. Last week in São Paulo, which is the state that's hardest hit in the total numbers of coronavirus patients, announced that their ICU wards were 70% full. And only a week has passed, and the number's already gone up to 80%.
Thank you, Brian. Meanwhile, also in Brazil, the government has begun to dig mass graves in the city of Manaus. The virus has hit the northwest city particularly hard, with at least 163 deaths and over 1,000 infections. And United Nations Economic Commission for Latin America and the Caribbean, ECLAC, says that the region is set to face its worst ever recession with a fall in GDP of 5.3% in 2020 due to the coronavirus pandemic.
This effect will guarantee the biggest recession that the region has suffered since 1914 and 1930. That's the magnitude we are talking about.
And hundreds of people in Chile have protested against the measure for return to work announced by the government. The protesters concentrated in Baquedano Plaza in the Chilean capital to reject the measure named New Normality announced by the Sebastián Piñera's government. The regulation outlined the gradual return of over 100,000 state employees to their workplaces, despite the fact that the World Health Organization has reiterated the continued risk of a spread of the coronavirus. During these demonstrations, at least 10 people were detained by police who used water cannons to disperse protesters. Time for a first break. Remember, follow us on Twitter at Telesur English and on my account at Laura P. Telesur. We'll be right back with more news. We are back with our news. In Yemen, the Saudi-led coalition announced on Wednesday that its forces would begin a ceasefire on Thursday, a step that could pave the way for the first direct peace talks with the Houthis after more than 5 years of war. In a statement by Saudi Arabia's official state news agency, a military spokesman said that the ceasefire would last 2 weeks and that it comes in response to United Nations calls to halt hostilities aimed at the coronavirus pandemic, adding that the ceasefire could be extended to pave the way for all the parties to discuss proposal steps and mechanisms for a comprehensive political solution in Yemen. There was no immediate reaction from Houthi leaders or Yemen's internationally recognized government. And the Nigerian Director of Defense Information, Major General John Eneke, has announced that Abubakar Shekau, leader of Boko Haram, may surrender soon, and that the end of the armed group is drawing near. John Eneke explained that Shekau's body language after recent military attacks against insurgents showed that it's close to giving up, also clarifying that there has been no official contact with Shekau, although he anticipated this event could happen quite soon. Recently, several Boko Haram high-ranking leaders were killed in air raids in northeast Borno state. Boko Haram has been trying to set up an Islamic caliphate in North Nigeria since 2009 and has carried out terrorist attacks against other territories throughout the Lake Chad Basin. And South African government confirmed on Tuesday more than 3,400 COVID-19 cases. Health Minister Saweli Sehi-Sisi detailed that in the last 24 hours there were 165 new cases of the novel coronavirus, as he announced an increase in the capacity of testing. Likewise, the Health Ministry informed of 1,055 patients recovered, and the total number of cases is now 3,465, as 58 people have died.
One of the important things that comes with this is that, so it's important that we won't get to a point where we are satisfied with the testing. We still have to test more people, particularly those who are at high risk, those who are most vulnerable, before we start to do general testing. And also we have to be able to get into a point where we are able to, all the known contacts should be tested and we should know their results. And at the current moment, we are doing very well with our tracing. It's almost above 95 of the known contacts.
As of today, the total number of COVID-19 cases in South Africa has gone up to 3,465. The total number of tests already conducted is 126,937, of which 5,427 were done in the last 24 hours. We make the point because we have been increasing the capacity of testing, and therefore the numbers of tests have averaged between 5.5 to 7.1 thousand tests on the 24-hour basis.
And the South African government has unveiled a $26 million relief package aimed at supporting the economy amid the COVID-19 pandemic.
We are announcing this evening a massive social and economic support package of 500 billion rand. Another significant area that requires massive additional expenditure is the relief of hunger and social distress in our communities across the country. We recognize that food distribution capacity of the government is not adequate to meet the huge need that has arisen since the start of the epidemic.
The government of Ethiopia reported 3 new cases of coronavirus in the country. 2 of them are local contagions and another comes from abroad. With the new infections, numerous of cases of COVID-19 rose to 114 in the nation. The report submitted by the Ministry of Health states that at least 16 patients have recovered from the infection, while 3 other citizens have died. Meanwhile, President of Madagascar, Andry Rajoelina, has launched a herbal medicine which he claims is a remedy for the coronavirus. The herbal mixture known as COVID Organics has been made from local medical plants like Artemisia, among others, and is claimed to be able to prevent and cure patients suffering from the virus. The medical remedy has been produced by the Malagasy Institute for Applied Research. However, the mixture has not been proven effective against COVID-19 by any published scientific studies, and the World Health Organization has also urged utmost skepticism over claimed cures for COVID-19.
So today I think I'm convinced, I'm persuaded. In fact, history will prove us. But today there are already 2 cases that have been cured with the plus Tambovi CVO plus. But we will see what happens next.
In Kenya, following heavy rains that resulted in devastating floodings in western Kenya, people were forced to evacuate their homes. Overnight, regional flooding forced the evacuation of the village of Kisumu, affecting also the lower western side of Kano and the eastern parts of Kano, while many houses have been destroyed as a result of the floodings.
We are observing all the regulations on coronavirus, but now that we have been driving out of our homes by floods, I fear now we are going to get it. It will not kill us. Everything went with the waters, all my clothing, even the shoes went. All are gone and nothing is left.
Time for a second break. We'll be right back with more news. Just stay tuned. Back with our news, Russia has said that dropping oil prices below zero is nothing but a speculative act, while also rejecting apocalyptic predictions due to the COVID-19 pandemic. While further oil sales for May collapsed on Monday, real oil prices have not yet been affected. A spokesman for the Kremlin clarified the news of the 305% drop in WTI West Texas oil prices to minus $37 per barrel, saying it is an uncomfortable situation, but even so, it cannot be associated in any way with the current dynamics of oil prices, adding that Russia is closely following the situation after the Brent price dropped nearly 30% to $18.33 per barrel from the first time since January 2002. Meanwhile, Wall Street tumbled for a second straight day following a collapse in U.S. future oil prices on top of a glum forecast by companies of a deep economic downturn. Despite the collapse spilling into June futures contracts, the latest West Texas Intermediate, the WTI benchmark, stands at $12.48 per barrel. Nonetheless, equity investors have become wary of the extent of the damage caused by sweeping lockdown measures that have halted businesses' activities and sparked millions of layoffs. Now, to have a better idea on how oil prices have been behaving, we have for you this image on your screens. As you can see, you have here how the oil prices have been behaving since yesterday, Monday, April the 20th. As you can see in your screens, here it started the day and then it's been going down every single minute, and here you have almost minus 50. It has gone the oil price, the WTI, the West Texas Intermediate, the oil that is a reference for United States. Now we have more details from United States because the country continues to be the hardest hit by the pandemic. We go there to Washington to our correspondent, Jorge Gestoso. Jorge, welcome.
Thank you. The cases of coronavirus has already surpassed 800,000 in the U.S. and the deaths are getting very close to 45,000. So the pandemic is still not under control. And most definitely, that is creating a lot of question marks. For example, 3 states, we're talking Mississippi, we're talking Georgia and South Carolina, are reopening their economy very soon. We're talking, in case of Georgia, by Friday, they're going to do it in stages, which is creating a lot of question marks of what if the new cases are going to show up, if it's not going to be more complicated that start to fight the virus since the very beginning. At the same time, we have seen that in at least half of states, there are hospitals that are cutting the salaries, the payroll of emergency doctors by 40%. And the argument is that they are losing money because that is, of course, private hospitals with for-profit organizations, because they're saying that because they're not practicing, they're not performing surgeries as much as they do regularly, that is exactly in that area that they make the money. Now they are being obliged, quote unquote, to cut the salary of the very key people fighting the pandemic. We're talking about the doctors in the emergency room by 40%, and the Association of Doctors say that that could even represent the closing of some emergency rooms. In terms of the economy, the slowdown of the economy, we're talking that being at home means that people are not consuming. Because they're not consuming, they are not producing. Because it's not being produced, there's no need for oil. So the prices of the oil in the US for the second day in a row plummeted again and was dragging the stock market again for the second day also in a row in a free fall. We get back to you now.
Thank you, Jorge. That was Jorge Gestoso from Washington. And as he was announcing this Tuesday, New York governor presented guidelines on state plans to gradually ease up on restrictions as the total number of statewide hospitalizations have been slowly dropping along with daily death toll.
We operate as one state, but we also have to understand variations, and you do want to get this economy open as soon as possible. And if a situation is radically different in one part of the state than another part of the state, take that into consideration. And that's what we're going to be doing.
Meanwhile, President Donald Trump announced that he will be signing an executive order that will block the entry of all migrants for 60 days.
I will be issuing a temporary suspension of immigration into the United States. You heard about that last night. By pausing immigration, we'll help put unemployed Americans first in line for jobs as America reopens. So important. It would be wrong and unjust for Americans laid off by the virus to be replaced with new immigrant labor flown in from abroad. We must first take care of the American worker, take care of the American worker. This pause will be in effect for 60 days.
Trump highlighted that this temporary suspension of immigrants will likely be put into effect this Wednesday.
We'll have certain exemptions because you're going to need certain exemptions, but we'll be notifying you tomorrow. We'll sign it most likely tomorrow, being drawn now and tonight. And it's something we have to have in this country. We have to have it.
In United Kingdom, Britain's House of Commons, where lawmakers notoriously jeer at their rivals, is about to find out whether it can make ministers sweat over video conference. When Parliament returns this week for its first news session in the age of coronavirus, just 50 of the 650 members will be allowed into the chamber as part of social distancing measures. Another 120 will be selected to appear via video conference.